Good seeing you, sir.
Ladies and gentlemen, and especially our distinguished guests, on behalf of the Kettering Medical Center Network, Grandview Medical Center, and the Grandview Foundation, we welcome you to our groundbreaking ceremony this afternoon for the new Hopeland Family Health Center. Thanks to each of you for joining us today as we celebrate a dream come true for many thousands of Dayton residents who rely on Hopeland, the largest clinic in Montgomery County. I'm John Murphy, Vice President of the Grandview Foundation, and I can guess that you probably are all wondering what these stakes are for at your seat. Actually, this is not your usual groundbreaking. It's a little different. And actually, it's different because you all get to participate. Unlike when typical groundbreakings occur and you have a shovel and turning the dirt. We changed this part to emphasize that we are all stakeholders in our community in separate ways. And these stakes now represent the ways in which we are all involved in a community initiative such as Hopeland. We will give you some time later, after hearing from our speakers, to write something personal, something meaningful on your stake, which you will be able to place in the outlined area to my right. That area is outlined in the shape of the building behind me, as it will be when renovation and construction are completed. So you see, you all are part of this wonderful celebration. You all symbolically become a part of this community health center. We also have something else for each of you, a remembrance gift. It's a commemorative hourglass to remind you that time is of the essence. That statement is even more true as we embark on a fundraising effort to garner support in order to complete this project. Because the sooner we raise the funds, the sooner we can invite you all back here for a ribbon-cutting ceremony as we open the new health center. It's now my pleasure to welcome some of the distinguished guests who are sharing this important moment with us this afternoon. As I call your names, please stand and be recognized. And since we're a friendly group, feel free to wave to the crowd. Barbara Skank is with us, and she is the State Director from Michael DeWine's office. She is representing Senator DeWine, and thanks for coming, Barbara. Jim Van Grove, the District Director of former Congressman Tony Hall's office, is here. And Jim, we're glad you could make it. Next, Governor Taft's Regional Director for the Ohio Department of Development is here representing Governor Taft. Anthony Whitmore, please be recognized. Ohio State Senator Tom Roberts is joining us this afternoon. Tom, thank you for being here as well. Joining me on the stage, we have Her Honor Dayton Mayor Ryan McClinn. Thank you, Mayor. We have two of our Montgomery County Commissioners joining us this afternoon, Vicki Pegg and Chuck Curran. We're fortunate to have Dayton City Commissioners Dean Lovelace, Richard Zimmer, and Joey Williams with us this afternoon as well. I'd like to also add that Commissioner Williams is a trustee of the Grandview Board, Grandview Foundation Board. We also have Dayton City Manager Jim Deneen, as well as former Dayton Mayor Mike Turner. Joining me on the stage, we have Dr. Kenneth Pugar, who is the Grandview Foundation Chairman. Dr. Pugar? Dr. Myro Robbins, who is the Family Practice Program Director and will be doing quite a bit of work here in the center. We're also pleased to have Dr. Robert Kane, who is the Program Director for the Internal Medicine Residency Program at Grandview Hospital. We have Kettering Medical Center Network President and CEO, Frank Perez. Frank? And Grandview Medical Center President, Dr. Roy Chu. We're also pleased to have Kettering Medical Center President Fred Mancher join us this afternoon. And perhaps most importantly, we have the Hopeland Family Health Center staff as well as the Corwin-Nixon Community Health Center staff as well here with us. Would you all please stand and be recognized? I apologize if I missed anyone. We're glad you're all here. We're glad you're here to help us celebrate. To begin our celebration, I would like to invite the Director of Pastoral Services for the Kettering Medical Center Network, Dr. Mario Sabalas, to offer our invocation. Mario?
Ministers have the great privilege of always being placed in the crossroads of life, not only of people, but also of beautiful projects as the one that we have. And it is my privilege today to deliver the invocation. And I would like to ask you to please stand up. Let us pray. Dear God, we have come here together in this very important occasion to celebrate the opening of a program that is like a safe net, a place where people can come and receive what they most need, medical care. We thank you, Lord, for the Grandview Foundation, the Grandview Medical Center, the leaders of the city of Dayton, the leaders of the Kettering Medical Center Network, for having the vision of providing a place such as this, where people that have the need can come. Lord, I pray that you be with this occasion, that you bless the procedures, that you bless the program, and that when this whole center will be completed, that will be a great place of healing for everyone that comes within their gates. I pray in the name of the Lord Jesus Christ. Amen.
Thank you, Mario. Now it is my pleasure to introduce someone who definitely believes in dreams. Many of us at the Kettering Medical Center Network know this because we have witnessed this reality ourselves. He was recently appointed to the highest level of leadership in our industry, that of board member of the American Hospital Association. This speaks to his ability to dream big. May I introduce the President and CEO of the Kettering Medical Center Network, Frank Perez.
Thank you, John, not only for the introduction, but mostly for making this a reality. You may have dreams, aspirations, and desires, but it requires individuals like John Murphy to say, I too believe that it can happen. And then besides believing, moving on and saying, I will work to make it happen. And he's been very gracious in introducing all of us. I would ask that you please at this moment acknowledge Mr. John Murphy for joining and making a big part of this dream a reality. Without him, I know it wouldn't be happening. I would be remiss if I did not introduce my board members. And I will ask that at this time, board members for any of the multiple boards for the network, please stand and take a bow. Would you please stand? I know I see you all over will you please, my board members for the foundations, for the hospitals, for the network, for any of this, these men and women are committed to serving voluntarily the communities in the greater Dayton area. Without their willingness to make and embrace our dreams, none of this would be happening. Will you please help me honor them? And there are always senior members of our boards, individuals that have served with distinction, and I would be remiss at this moment if I did not acknowledge at least two of them. One is Jack Fritchie. Mr. Fritchie is the longest-serving member of the Kettering Medical Center and Kettering Medical Center Network. Will you please help me acknowledge Mr. Fritchie for his many years of support? And then an individual that is an institution in our community and in our state, and is the Honorable Corwin Nixon. Will you please help me? Thank you, sir. Thank you, sir. Without their guidance, without their support, I can guarantee you that we would not be here today. The mission of the network is to improve the quality of life of the people of our communities. What we are engaged in doing here today is taking one more step forward in making sure that not only are we going to improve the quality of life of the people of our community, but we're going to bring this immediate community to a new level of amenity and elegance for which we're very grateful. It is obvious that these things don't happen in a vacuum. They happen because they are following a legacy of service that has been established for a long time within our boards and within our communities. We are indebted to Jim Spiegel and his wife. Is Jim here? I see them there. Will you please stand up and take a bow? Let me tell you how this couple have been a blessing to you and to us. After serving for many, many years as a senior administrator at Grandview and retiring, he left an endowment within the Grandview system, an endowment that the foundation embraced. And when one philanthropist in the area said, I will give you $300,000 to help buy these facilities, and challenged that you raise the other $300,000, we were blessed that the Spiegels said, we will match that fund so that these facilities could be acquired and we could take the first step towards seeing the vision for the new health center. So like that, there are so many stories that individuals have committed their lives and their resources to make sure that we could come this far. Now, the fact is that we're not all the way there. So we will continue to work diligently, and I know that John has committed all of us to do that, to make sure that what we have started can be completed. And for that, we are appreciative and we are honored. You're witnessing a dream that is beginning to take shape, that began in the summer of 2000. I wasn't even here. I was with a long time planned trip overseas, cruising the Danube with my wife and friends. And before leaving, I was asked by the administrative staff, Dr. Wise in particular, and Roy and others, so what's going to happen with Franciscan, as we always known it, St. E's? I said, don't worry about it. The people that are going to buy it were in my office last week. It's a done deal. This is going to turnover, we're going to be okay. I don't think I was gone 5 days when I got the news. And Roy was saying, and Greg were saying, guess what? You had bad information. You didn't get the story right. It's not happening. And although I was not here, Greg and Roy and others with board leadership stood up to the plate and said, we can't wait until Frank gets back. We're going to do the right thing, and we're going to trust that, one, the Lord will continue to lead us, two, that the community will respond. And that's how we're here. Because a man of vision, of character, said yes when the duty called. And I was reminiscing with Commissioner Pegg when we were at a meeting of the chamber after I had returned from my trip, and her concern after seeing numbers and seeing the number of behavioral patients, psychiatric patients that were cared for at the Franciscan St. program, she looked at me and said, Frank, what are we going to do? This is incredible. We can't let this happen. And I said, Roy's taking care of it. She gave me a hug. I said, next time you see Roy, will you give me a hug too? Just so that he doesn't feel badly. But that's the spirit of community that exists here. And you are our inspiration. You are our support. And we are honored to be entrusted with your health care, with a commitment to improve the quality of life of the people of our community. Without you, we could not do it. God bless you. Thank you very much.
Thank you, Frank. Let's step back into history for a moment and hear briefly about the past of the Hopeland Clinic. We have two doctors with us this afternoon who have been long-time supporters of Hopeland. I'd first like to introduce Dr. Bert Seidel. Dr. Seidel was one of the original members of the St. Elizabeth Foundation. He worked tirelessly on behalf of Hopeland and those who are served by Hopeland. And I'd like to ask him to share a few of his thoughts about what Hopeland has meant to him over the years.
Thank you, John. It seems that at my stage of life, historical perspective is what I can always bring to a gathering. I'm pleased and honored to join this distinguished podium and all of the distinguished people in the audience. When John called me and asked me to do this, I was pleased and I was a little surprised. But then John, in his candid way, said, well, you know, of the people who've had experience with St. E's and experience with the Hopeland Clinic and experience with the St. E's Foundation, there aren't very many of them alive. So, for the moment, my good friend Percy Fraser and I are here, and we're gonna make it through this program anyway. I'm particularly pleased to see so many of the forever young ladies that I worked with so long at St. E's. To me, you haven't changed, and I can give you a certificate from my optometrist that I can see. You know I love you all, but I don't want any of you to ever tell the jokes we told up in the operating room. I had to think on the way over, 45 years ago I joined the St. E's staff. And I drove past Good Samaritan to get here, or to get there, because I felt a camaraderie and a dedication to the quality of medicine, and in my case dentistry, that while it was not missing from the other hospitals, had a special ingredient, a special sauce at St. E's. And the longer I practiced there, and the more work I did, and the more friends I made, I realized how much a part of the needs of the community St. E's, and as we organized the Hopeland Health Clinic did, the numbers, ladies and gentlemen, are staggering. And they were staggering, and they're nothing compared to what's going to happen thanks to the dream of John and Frank and all of the people who are so dedicated to making this come alive. After a number of years on the St. E's staff, they organized the St. Elizabeth's Foundation, which became the Franciscan Foundation. I never could say Franciscan. I always said St. E's, and to this day, that's my moniker for the hospital and the foundation. And coming into the foundation was another whole opportunity to lift my sights beyond the delivery of health care. I saw what programs were being done and how people, financiers in the community, philanthropists, corporations, banks, were coming to help, not because of high notoriety or because of high exposure, but because it did such an incredible thing for the health of our community. And that was an enriching experience. Along with that enriching experience, tell them I'll be home. I got to work with John Murphy, whose tenacity and whose love and whose ability surpasses his tender years. To me, he's just a kid. And by God, he's a kid I really love, John. But I also got to work with Vic Casano and Tony Lair and so many others. And I always knew Vic. I always knew that his was the pizza that I liked the best. And as I got to know him in the community, the man was an icon. He was everywhere. He was at UD basketball games. He was at any good cause. But as chairman of the foundation for so many years, he taught us so much. He taught us that you have to be patient, that you have to be loving, that you have to be understanding, and you have to look past your own nose, past your own feet, and past your own circle. And we did great things. And so, as one of those still alive who remembers Vic very well, I'd like to pass just a little of his special spice on to all of you. Again, I'm so pleased and honored to be here. I thank you for the invitation. And now, I know this is going to happen because nobody says no to John Murphy. Thank you very much.
Thank you, Bert. I'm glad you were able to make it this afternoon. I'd next like to introduce Dr. Percy Fraser. Dr. Fraser has been a practicing physician at Hopeland for a number of years and continues to work there today. I'd like to ask Dr. Fraser to share his perspective on how he sees what's taking place at Hopeland today and what he looks forward to seeing in the future. Dr. Fraser?
It's good to be here because I not only get to see you guys, but I get to see some of my patients. Hey, Manny Johnson. Every time I meet my patients in the mall, they say, I got to come and see you. I was at Hopeland Clinic since I got out of the Wright-Patterson Air Force Base in 1983, and I stayed in the city of Dayton. And I moved my practice over there in '91, and I took care of the OB section of the family practice physicians. And there we taught family practice physicians how to do obstetrics and gynecology. And I was surrounded by my friends who I could call on if I need help. Surgeons, orthopedic surgeons, internists, all these bad doctors that gave free care to my patients. And all of a sudden, St. E's was no more. And I was in there doing that phase where we turn. You remember that commercial? And we were doing fine. And as we turned, and at St. E's. And all of a sudden, St. E's was closed. And we had all these employees at St. E's who had worked hard and diligently, and they were stunned because there was no warning. St. E's just closed. You had bad information, right? And every week, if you were at St. E's, you heard somebody different was going to buy the hospital. And that happened for a while, and then reality. I think I was the last doctor. They put me out. I was the last doctor to leave, the office building there at St. E's. They turned the air off, and I didn't have any air in the building. And, yeah, and the building was still open. I was worried about the code and everything. It's my buddy from the fire department. And I said, how can they keep me in this building and there's no air in here? Anyhow, but we survived. And I had, my problem is I had 20-some residents that were still in training, and they needed to complete their training. And we had offers from some of the other facilities around that they're going to take my residents and make sure that they finish their education. A lot of these residents stayed right here in the Dayton community, and they're practicing right here. And it wasn't my MD buddies. It was my DO buddies across the aisle that rescued me. You know, they taught me how to do spinal things now. I'm getting into that. But, it was those physicians that from Grandview and Southview that stepped in to help me finish train my family practice residents that were at Franciscan. And I'd like to applaud those physicians. And then we still didn't know what was going to happen to us, but I met this guy called Roy Chu. He's a very quiet guy until you get him in a meeting and he really wants something. And I saw him in action. I said, Roy, is that you? And he was determined to do this. So we went to the neighborhood associations, and some of them are here. Welcome. And we convinced them that we should be here, that we took care of patients with insurance, patients with Anthems and Blue Cross Blue Shield, patients with Medicare, Medicaid, and Medicare, and patients with no care, with HCAP and the like. We took care of those patients. If St. E's took care of families. I delivered a girl the other day that I delivered. Didn't that sound? And I'm not that old. But she was at Hopeland Clinic, and she said, you delivered my mother. I said, stop. And she said, yes, you did. And it was good. It felt good. And it felt good for Grandview and Southview and the Kettering Network to come over and help us, because they didn't have to. They really didn't have to. Because we were stunned. As a matter of fact, every year now, St. E's employees get together at a park, and we meet at the park to try to renew those friendships that we used to have, because we had a family at Franciscan. We took care of families. It was a family hospital. The only residency that was really there was a family practice residency. All the other residencies rotated through the hospital, but the residency that was based at the hospital were family practice physicians. So we trained family practitioners for this community, and a lot of them, a lot of good ones. So in stepped my buddies from across the aisle, my DO buddies, and they said, Frazier, you're now in the DO world. And I go like, where is that? Do-do-do-do-do-do-do. And they began to show me how to do joint manipulation. Now, I'm still learning, but they showed me to do that. But it was a good thing. It was a wonderful thing. And we went around to neighborhood associations. We went to the county commissioners. We went to my buddy Dean and Ryan. Dean said, make sure the community wants this now. You can't put it there unless the community wants, because I'm a community man. I said, Dean, I know. So Dean helped us out a great deal, too. I'm just messing with you, Dean. Anyhow, and Dean helped us along with the neighborhood association. It's good to be here. We take care of patients. When I deliver a lady, I don't ask her if she has insurance or not. I don't worry about it. You know, God takes care of me. This poor little southern boy all the way up here. You know, I've been authenticated by the big guy, so I don't worry much, you know, about anything. And that's why I didn't worry too much about Hopeland, because I knew God would take care of it. And with the help of these gentlemen, ladies and gentlemen here, he's taking care of it. It's not a circumstance, or it's not something, a third dimension. It's reality that the people in Dayton cared about Franciscan and what happened to Franciscan and what is happening to Franciscan. So it's not a surprise that we're going to be here. We went to one meeting and they says, oh, do you have derelicts hanging around your clinic? I said, no, we have your aunts and uncles and cousins. And Those that are not as fortunate as you know those ones that call you up and you don't answer, don't return the calls? We have those people. And remember that most Americans are about a paycheck or two away from poverty. If you were invested in Enron and retired, you may be back at work right now. So, we take care of people. And don't forget the least of these. Because God said we shouldn't forget the least of these. So I'm proud of what the Kettering Network did for us. I'm proud of what my fellow physicians from the other side of the aisle, the DO docs, did for us and did for me. And they continue to help me down in Southview. If I need any one of them, they call me. They come. Dr. Gabriel, Dr. Vitos, Dr. Tyner. And these guys do care for nothing. They come and they help me because a lot of these patients can't pay. As a matter of fact, I learned a lot of DO docs over there volunteer for what they do. I said, we MD doctors, we don't volunteer for much. And these guys volunteer to do things. So thank you. Thank you for your help. Thank you for being here. And let's look forward to this health center.
Thank you very much, Dr. Frazier. It's a pleasure to have you here. It's good to see you again. As you've heard from Frank and from Dr. Frazier and Dr. Seidel, there is one person who's sitting on the stage here today that is really responsible for Hopeland's rebirth. And that happened when all seemed lost. That individual is my boss, Roy Chu, the president of Grandview Medical Center, and I might add, an extremely compassionate individual. Roy will give us an overview regarding the future of this health center, and he also has a special surprise to introduce. Roy?
Thank you. First of all, it's a little bit hard to talk about the future without acknowledging the help that we've had thus far. When the announcement that Franciscan was going to close was made, we did have several people step forward and help us, and I'd like to acknowledge them because they did it in a very material way, a financial way. First of all, 2 years ago, the Mateel Foundation and the Levin Foundation both gave us Mateel gave us $1 million, and Levin Foundation gave us $500,000 to help with the transition costs for not only for Hopeland but for the psychiatric program, which was the largest in Montgomery County. So those foundations allowed us to do something on a transitional basis that we could not have done alone. Then secondly, the Montgomery County Commissioners and Bill Bynes, the Montgomery County Health Commissioner, allowed us to access the Montgomery County Healthcare Levy Funds, which helped us support the operations of Hopeland Clinic. Then next we had Congressman Tony Hall, who along with Senator Mike DeWine and Representative Dave Hobson got us a grant last year that in the amount of $600,000 that we could use for the future building of Hopeland. But that money could not be used to buy this land or to buy the building. And that's where Jim Spiegel came in, the former chief financial officer of Grandview, who offered $300,000 and then along with an anonymous donor matched that in order to buy this property. I don't think anybody, any of those people who gave them money would have been led to do that just by me or by people who worked for me. I think it was really the community, the backing of the community. All of the city commissioners and the then mayor supported it. All of the county commissioners, all of the present city commissioners and mayor supported this. We had the support of the business and civic community, most specifically the Dayton Development Coalition, under the leadership of the president, Ron Wine, And the chairman at that time was Dan Sadlier, and today's chairman is Bill Schneider from Miller Valentine. And without the support of the business community and the civic community, as well as the public community, none of this would have been able to happen. Also, Wright State University was really still responsible for some of those residents there, and the support of the medical school dean there, Dr. Howard Part, and Dr. Klassen, who was head of the family practice program, were really very instrumental, along with Drs. Mary Budzak and Andy Foley, helped keep things together, and of course, Dr. Percy Frazier. And what people don't realize is that when Hopeland closed, there were 30 residents there, and within a couple weeks, those 30 residents were down to 12. And it was really those residents who, with the physicians I just mentioned, kept Hopeland going. That's the past and the transition. What I'd like to talk to you about today is the future of Hopeland. To me, the future of Hopeland is actually much brighter than its past. We're still going to see family practice at the core of the Hopeland Clinic. But along with family practice, we expect to see a lot of specialty practices there as well. Internal medicine, neurology, OB, orthopedics. These are just some examples of some of the specialty services that will also be available at the clinic. This availability of specialists is so vital to an institution like this. I have visited other clinics in other cities where somebody is employed full-time to be on the telephone to call around to specialists in the city begging them to take patients. And that doesn't happen. That won't happen under the new model because we'll have these specialties right there in the clinic with us. It's going to be a medical education model, and there are speakers here today who are going to talk about that. But the value of the medical education model is you have the bright young residents full of new knowledge and vim and vigor, and you've got the more experienced physicians, and they won't say this necessarily, but I will on their behalf. The best physicians in town are there providing hands-on supervision of those patients, so you get the best of both worlds. And Grandview is uniquely able to do this. I don't know if you're aware of this, but Grandview is the second largest teaching hospital for osteopathic medicine on a national basis. In Dayton, we have the largest number of residencies at any one institution, and so we'll be able to provide this kind of model. The other thing that's neat about being on this site is to be part of the rebirth of the Wright-Dunbar district. Just think coming down Edwin C. Moses Boulevard, what you'll be seeing is the picture of the building in front of me, and, well, it's not on the screens anymore. When I drive by here, that's what I see now anyway. I don't see the Tasty Bird factory anymore. That's what I see. I can even take you through it if you want to, a little mind tour. Also, because we're going to be a freestanding center, we're going to have much better access for our patients through the RTA system and through parking. We also plan to add space for community health education programs. This puts into practice the osteopathic medicine emphasis on wellness and prevention. In summary, the future of Hopeland is going to be brighter than its past. We'll now combine family practice along with specialty medicine. We'll use the medical education model. We're going to provide community health education and screenings. We're going to have a more accessible location. We'll be part of the Wright-Dunbar Village. To me, all of this is far better than we currently enjoy. Now we're going to continue to need your help and support. Actually, Senator DeWine and Representative Hobson have volunteered to take over from Tony Hall since he's left office and pursue a federal request for funding for yet this year. Our state representatives and senators have also agreed to take a request to the state legislature. With your help, we're going to be able to help those in need and in need of health care. 2 years ago, when Grandview and the Kettering Medical Center network were able to step out in faith to save Hopeland, it was not with faith in ourselves. It was faith that Dayton is a community where people care for each other and support each other. So we can only do this because we have faith in you. At this time, John had mentioned we're going to do something special. And 2 years ago, we had a smaller ceremony of appreciation for people who had helped support Hopeland in the transition. And I had this great idea of having a patient come up and tell about Hopeland, because you can only really understand about Hopeland by talking either to a patient or a staff member or a physician who practices there. Well, my great idea, I thought it was a great idea, but at the last minute the person got stage fright, and so it never came to fruition. So this time we thought what we would do is we would actually videotape some patients and staff in the Hopeland setting. And at this time, what we're going to do is, I think you'll agree after you see this, that really the patients and the staff and the physicians can tell the story best. So if you roll the tape, please. It's going to be on the screens to either side.
It blows me away. It's just the caring, honest to God caring, that everybody, not just the nurses, not just the doctors, my office staff, everybody here, everybody honestly cares about these people. So that's probably why I was a patient here. That's probably why I'm glad to be working here. There was fear in the community, desperation as to what was going on, what was going to happen. And the doctors were, that's what's amazing, the doctors were more concerned about their patients than anything else. Not so much about where their next job, where they may go. They were honestly, actually concerned about these patients, their well-being and their care.
I think Hopeland is a special place because they help people when they need to be helped. When I didn't have insurance, they helped me before I got my job and got my insurance. And they took me when nobody else would take me without insurance.
We here at Hopeland see any range of patients. We have a patient that's close to 100 years old and 1 day old.
Because it's a place that helps you, especially with the single mothers with little babies. They tell them if they need help with them, they come here and they help them. Then they have the social worker that helps them through any problems that they have.
With the elderly, those patients are our specials. Most of those patients have worked very, very hard all their lives at one thing or another, no matter what they did to make a living, and now they're at the age to retire. And retirement is not that great financially. Medicare itself does not supply any kind of prescription coverage, any kind of mental health issues they may have, any issues, how to deal with family, somebody to talk to. We have a representative from the job center that's here that will help them.
If it wasn't for Hopeland Center, I don't know what I would do. They have been very helpful to me. They signed me up for the HCAP insurance, which will help me out as long as it will continue. I do have high blood pressure. It runs in my family. And as long as I've been coming here, I've found out that the doctors are very wonderful.
We've had a particular child. The mother was young and didn't quite understand all that it takes, I would say, in raising a child, an infant. He was underweight, and we needed something done right away. The mother had been counseled several times. The child was referred to Children's Medical Center to get started on a program right away so that he would get his weight, so they could eat, so he could get the proper nutrition. Unfortunately, the mom is no longer in his life, but the child is healthy, he's doing well, and it's wonderful to see that. In my opinion, we're always constantly stepping in, intervene, always trying to educate our patients, our clientele, constantly.
Questions are asked. Sometimes they think we're probing, but we let them know it's just so that we can get them the education they need to survive. This day and time, it's very important for us to get them very, very young, keep them in the system, and keep them going.
It was really hard to take when I found out I was a diabetic. It really was. I didn't take it well, but now I'm trying to take it. And it's a nurse here, one of her kids have the same thing, so when she talked to me about it, it made me feel more comfortable because I felt that, well, you know, here it is, her child is 9 or 10 years old, and if she can handle it, I should be able to handle it.
When I was very, very young, I went to visit my homeland on the Cherokee Reservation. There is no medical there, none. Well, at that time there wasn't. My dream was to come up with a clinic for that reservation where those people could be treated, get what they needed medically, be educated, know what everybody else in the world knows. Because of its location and my family life, I was not able to move back to the reservation. Not being in that location, donations is all I can do. But I found Hopeland. Hopeland is the same thing. It is that type of clinic. These are people, and I hate to say this, but they've been forgotten. They fall through the cracks. Our goal here, when a patient walks in the front door, is to imagine that your mother or father standing on the other side of that counter from you. How would you want them treated? And I can honestly say my employees do see one of their relatives standing on the other side of that counter, and that's the way the patient is treated. Hopeland was here before Grandview took it over, and a lot of the employees had a chance of transferring and moving on to what others considered bigger and better things. There is nothing bigger and better than Hopeland. The feeling you have when you walk out of here at night, even if there's just that one patient that you touched, makes it worth it.
I've seen that video probably 6 or 7 times and it still gets to me. How about a round of applause for those that work at the clinic? I'd like next to invite some of the physicians who are involved with the clinic currently from Grandview. I'd first like to introduce to you Dr. Kenneth Pugar. Dr. Pugar is the chairman of the Grandview Foundation. Dr. Pugar will say a few words.
Thank you, John. Well, on behalf of the Grandview Foundation Board, I would like to express our appreciation for everyone being here today. We consider today to be a landmark event in our young history of our foundation. As Roy alluded to earlier, and I remember something John told me when I first met him, is that what a gem, an undiscovered gem that we had over at Grandview, and that is our teaching and residency programs. I don't think people across the community realize that we have one of the largest residency training programs in the osteopathic community. And I'm here to say I've done training in Philadelphia, Michigan, Pennsylvania, both MD and DO institutions, and I'm saying with all sincerity that some of the best and brightest teachers, residents, and students are at Grandview. And I think we have to keep that in mind. These residency programs are excellent because of a very supportive administration and in a word that I'll call passionate teaching staff. I don't think you'll find a group of doctors anywhere that are more dedicated to teaching than at Grandview Hospital. This has led to, I think, one of the most sought after residency programs in the osteopathic community. And for years, the best and the brightest of our young doctors in training sought to come to our residency programs. And it's every teacher's goal there is to keep that going. But like most residency programs across the country, if you're not aware, there's some very real challenges that we're facing right now. There's been a tremendous reduction in federal support of residency programs. At the same time, it's getting more expensive to train residents as their needs and sophistication of what we're trying to convey to them in a shorter period of time ever grows. And finally, there's a shortage of good young residents across the country to fill the slots that are available, especially in the most needed primary care slots, such as family practice and general internal medicine, pediatrics and obstetrics. So it was this in mind that years ago we decided that we needed to support and do what we could to maintain the excellency in our residency programs. So the mission, I'd like to state the mission of our foundation. Our mission states that we will be committed to education that supports the unique osteopathic approach to healthcare and the delivery of high-quality medical services to improve the lives of the people of our community. And I take this mission very seriously. And initially, our sole focus was on supporting and enhancing the teaching programs. And I think Dr. Kane will be discussing some of that with you in a minute. But several years ago, when the fate of Hopeland Clinic was in peril, Grandview Hospital showed bold leadership and assumed its operation, preserving this much-needed service to the community. And the Foundation Board embraced this and was pleased to add Hopeland to its list of priorities. And I think this was a natural fit. We saw the opportunity with Hopeland for a synergy of our major mission goals. Not only could we support the healthcare needs of the community, but also develop a unique model of primary care and specialty clinics to allow our interns and residents opportunities to treat a population and gain experience they otherwise would not have. The stated vision of the Grandview Foundation is to develop partnerships that generate gifts and other resources, enabling the Grandview Foundation to achieve its mission. And as chair of the foundation, I pledge the board's support of raising the additional dollars needed in order to bring this project to completion. I'm proud to be chair of the foundation at such a crucial point in the history of Grandview, and pleased that the foundation is in a position to sponsor this vital community asset. And I'd like to thank each of you for coming today and look forward to when this old building will one day house the finest healthcare center of its kind in the state of Ohio. Thank you.
I'd next like to ask Dr. Milo Robbins to come and say a few words. Dr. Robbins is the program director for the Family Practice Residency Program at Grandview, and she and her residents will be doing quite a bit of work in the building behind us. Dr. Robbins.
I'm so honored to have been asked to speak here today before you because I am so moved by the support that I see in front of me of all of you who have helped to make this dream move more toward a reality. And the video that we saw is testimony to the importance of what we can bring to this community. I am the new kid on the block. I do not bring the history to you that you've heard before you. But as I said to you, I am honored to be a part of what I see coming in the very, very near future. Our family medicine residency is very enthusiastic about this very exciting challenge that we see rising before us. And we fully support the endeavors of bringing a new initiative in healthcare delivery to this Wright-Dunbar community. Our primary care programs serve the public in terms of meeting their healthcare needs, and this will only improve the access to healthcare for this community. And so we are very excited to be a part of it. The heart of the new facility is osteopathic medical education. We are taking the best and the brightest, as you've heard each of your speakers that preceded me speak to, and we are training them to return to you to provide health care. I'm excited to be a part of that, to be their trainer, to help develop them to return care to you. So we are looking for the foundation of osteopathic medical education in this new facility. And you've heard that besides primary care, it will be a blending of specialty as well, because we need access to the specialty care. So we are very excited to be at the core of this, but to be able to reach out to the patient population that we serve with all of the specialties that will be housed in the same facility with us. This will be a state-of-the-art facility. It's a very exciting endeavor for us to embark upon, to be able to occupy something like this. And I would like to see us bring all of our programs to be premier models for osteopathic medical education. And that's what I'm dedicating myself to, and I see that I have the support of all of you here. So it's a big, big event, and I thank you all for your support.
Next, I'd like to introduce Dr. Bob Kane. Dr. Kane is the residency director, program director for the internal medicine residency program at Grandview. And like Dr. Robbins, he will be doing quite a bit of teaching in the building behind us, and would like to say a few words about what that will mean to him. Dr. Kane?
Well, good afternoon. This is actually a very exciting time for me. And to some degree, I almost feel like a child on Christmas Day, because there's a little secret to this, or history to what we're doing here. Last year, about this time, my pager went off in the afternoon, and I looked down at the number and I realized it led to Dr. Chu and his office. Now, as a physician, when you look down on your pager and you see the number to the president's office, it sometimes reminds you, it evokes memories of being called to the principal's office as a child. So my first thought was, what did I do wrong? What I actually learned was that he wanted to take a drive along Edwin C. Moses Boulevard and look for a new location for our healthcare center. So we traveled from Grandview down to the other end at 75, and we stopped at a variety of locations. This was the spot that I felt most represented the needs that we had for Grandview Hospital and for our clinics. Partly because of the community that we see developing behind us right now at this very time. We have an area which we can provide a service to, and I hope that we can become a trusted part of that neighborhood. I also hope that our reputation will allow us to become an even greater service to the city of Dayton. It's interesting, I've heard so many people before me mention Grandview's reputation, and I am very proud of the fact that nationally, when I travel to meetings as a program director, we begin to realize the role that Grandview has played in the osteopathic medical profession across the United States. We are truly recognized as one of the leaders of the osteopathic profession. The strange part is that we're a well-kept secret within our own community. I have 56 volunteer physicians who work with me every month to provide training to our internal medicine residents. Volunteer physicians. They proudly teach, and they teach because they were taught by someone before them, and they feel that they owe something back to this profession. So I think it's very, very important that we look at the fact we're going to have a state-of-the-art facility developed behind us that can only help to improve our future in terms of delivering our training. Thanks to the Grandview Foundation, our internal medicine residency program is actually undergoing a major metamorphosis, and I am so excited. I have a support staff of about 8 physicians who will be working with me to do that, and I know that they are very dedicated to making sure that we see progress in our residency. We have had an incredible challenge to gain new residents into our programs. The doors have been opening for our residents to train anywhere that they would like in the United States. And somehow we have to offer a program that will bring them here to Dayton and here to Grandview Hospital. Our reputation from the past will no longer be enough. For years, we've been turning out quality graduates who have either stayed to practice here in the Dayton community or have gone to other areas in the nation and performed very well. We have some of the highest board scores in the country each year and one of the highest board certification rates in the United States on our first attempt. That's incredible. But unfortunately, we face a large number of challenges in healthcare. Most physicians today are being acted upon rather than acting to solve the challenges that we face. And one of the things that we want to do in our new residency program is to train our physicians to truly be leaders, not just to provide quality health care, but to be leaders within their medical communities. We think it's important that the new training program in this facility will include backgrounds in healthcare leadership, information technology, and critically understanding the business of medicine so that they're savvy physicians when they graduate, better than the people who trained them and better to offer back to their community. I'd like to thank the hospital administration, the board of directors, and the community for your support, and we look forward to a long and healthy relationship. Thanks.
Thank you, Doctor. We will now hear some words of congratulations from some of our distinguished guests. We're very pleased this afternoon to have Her Honor, Dayton Mayor Ryan McClin. Mayor?
Thank you. It's indeed a pleasure to be here because this is right in my neighborhood. I live right up the street and my family's been there since 1932. So I've seen this area, the Wright-Dunbar area, prosper, die, and be reinvented. And Hopeland Clinic will do exactly that for this area. Quality of life issues. When you think of a city, sometimes you wonder about those in abstract. Quality of life issues are important to a community. Health care is important to a community. And all of these things here lead to economic development. So with the Wright-Dunbar area and the Hopeland Clinic here, we're going to be having a very gem of a section in our city that I'm very proud to have. And you must be doing something right that when you have Commissioner Williams on a board and Commissioner Zimmer, I think he left, but I'm going to tell you, he probably would not have ran for city commission if Franciscan had stayed. He was volunteering there, so he had to have something to do. So, and so I just want to let you know that there is a volunteer in the makings for you. And I'm glad to have Commissioner Lovelace with me, as well as not being able to have, but her spirit is here, Commissioner Neal, because she's been a very big champion of the Wright-Dunbar area. So with that, I'm going to say thank you and look forward to the renaming ceremony.
Thank you, Mayor. It's a pleasure to have you here. Our next speaker is an individual that has shown significant support and interest in Hopeland ever since Franciscan even thought of being closed. From the very get-go, she was very involved and very interested in making sure that the patients that were going through Hopeland never lost their health care. She continuously kept in touch with those of us who were working on behalf of Hopeland and has championed the cause significantly. Please join me in welcoming Montgomery County Commissioner Vicki Pegg.
Good afternoon. You heard the first part of the story from Frank. I'd like to give you the rest of the story. You could imagine the shock that went through, well, we know it went through the entire community, but the shock that went through the local health district and the county commission upon the announcement of the Franciscan closing. And I'm with the rest of you. I was born at St. E. It is St. E. But as the numbers began to come in, the shock wore off and semi-panic began to set in. I did see Frank, and my first concern, because the first numbers I saw concerned psychiatric beds, and he said, as he told you, Roy's on it. Very few days later, my phone rings, and it's Roy. And Roy says, can you come out here? Yeah. Soon? Yeah. What do you mean by soon? Tomorrow. Okay. What time tomorrow? 8 o'clock a.m. Boy, I was there. I thought I was going to a meeting. I met Roy in his office, and we began to walk the halls. And we walked a lot of halls, and at one point I thought, this is a test. He's going to see if I can ever find my car again. And we walked, and we walked, and we rode an elevator, and we walked some more, and we rode another elevator, and we walked some more. And finally, the last elevator, the doors opened onto what I can only describe to you as a 3-ring construction circus. Roy wasn't just on it, Roy was building it as we spoke that morning. It was already in process. Then the numbers began to arrive on Hopeland, and we were absolutely astounded, amazed, and a little sickened when we saw what we were about to lose. You may have heard an earlier reference, it was almost in passing, but I believe John referred to Hopeland as the largest. In fact, it was the largest on such a level that they saw more patients per year than all of the clinics of the combined city-county health district. We knew what we were up against. I said, Roy, help. And he said, I'm on it. I took it off my to-do list. And just a few months ago, another call from Roy. I'm getting to understand this man. He said, can you come out here? Oh, yeah. I was out the next morning, and Roy and John were waiting for me. And they had the easel set up, and they had the paperwork all spread out on the table. There were the numbers, there were the facts, the figures. The easels, of course, showed the drawings. They were nothing short of spectacular. And I made the mistake, old dopey me, of looking at him, and he and John both, Roy and John, and saying, wow, can you do this? And they said, yeah. So I took it off my to-do list. And what thrills me now is that we're going to turn the little ground over today in preparation. And I can't tell you how excited I am to know, hopefully, next July, it's going to be hot. We're going to open this wonderful new facility that this community deserves and this community is willing to work for. I want to point out to you that not only do we have medical people in this tent today, community people, government people, we also have in this tent some of the top economic development professionals in this community. Normally, they're real worried about bottom lines, profits, and how a business survives. But we are a community that has the great good fortune to have big hearts, and that includes our economic development people. They are here too to make sure that this happens. I am personally delighted and thrilled. I want to say publicly in front of as many people as I possibly can, to Frank, to Roy, to John, to everyone involved in this, thank you from the bottom of my heart, because you're going to take care of people who need to be taken care of. And to the staff, of the clinic, of Hopeland Clinic, the Nixon Clinic, thank you so much. I don't mean to be corny, but as we saw on this video, you do put the hope in the Hopeland Clinic. Thank you, and I'll see you all next July.
Thank you, Commissioner. At this time, I would like to say just a few words about how well our fundraising efforts are going. For the past 10 months, we have been quietly working with a number of potential donors to tell the Hopeland story and to garner support for this project. It's going to take $5.5 million to make this dream behind us a reality. And I'm pleased that our initial presentations have been met with overwhelming approval. We'd like to thank Tony Hall for his efforts when Franciscan closed, as he came forward to assist Grandview by securing a Health and Human Services federal grant of $600,000. And I again have to thank Jim Spiegel, our former CFO, for his generosity. Thank you again, Jim. Last week, we received some very, very exciting news from an anonymous donor. After many, many months of studying the impact of the new health center on the health of the community, this donor has awarded this project a $2.5 million challenge grant. This generosity, of course, provides a challenge to the Grandview Foundation Board. However, if I can speak on behalf of Dr. Pugar, this challenge motivates us to work even harder to bring this project to completion. While we have begun some infrastructure work to the property, we will not be able to complete the health center until all of the funds have been raised. So please join me and the Foundation Board by offering your support of this healthcare initiative. Whether it be time, talent, or treasure, we hope you will join us in your own way to make this health center a vital resource to the Dayton community. At this point in the ceremony, I would like to tell you all about a very special person who is no longer with us, but whose commitment and concern for this community lives on in many ways. And I'm speaking of Vic Casano Sr. Some of you may not know this, but it really was Vic Casano Sr. who actually, many years ago, started working on behalf of the Hopeland Clinic to raise funds to support its mission in the community. It was Vic's idea to set aside a small portion of the old St. E's to create a space for patients to be seen by primary and specialty care physicians. His original idea of a small clinic certainly has grown over the years to require us to build this expanded facility. Please join me as we have a moment of silence to remember Vic and the great things he did for Dayton and its residents. Thank you. We're blessed to have some of the Cassano family members with us here today, and I'd like to move to the next part of our program, and I'd like to ask Mary Ann to join me up in the podium, if you would. And Ann, if you could stand by the sign, please. I would like you now, please, to join me in a round of applause as we unveil the official sign designating this facility the Victor J. Cassano Sr. Family Health Center. What's that? That's okay. Vic and Ann's daughter, Mary Ann, is here to join us and just to say a few words.
I just want to thank everybody for being here, and I know my dad would be very, very proud. Thank you very much.
Our many thanks to the Cassano family for their very generous support in allowing us to permanently attach Vic's name to health care for the less fortunate. As you remember from the beginning of our ceremony, we have included construction stakes at your seat for you to be part of this project. I hope and I'm sure that all of you have thought up many good sentiments to express on your construction stakes. So let's now all write on those stakes a thought that is with you today. And in a moment, we will all place them in the soft dirt in the building outlined to my right. Later on, some of our volunteers will be transcribing all of your wishes and comments from the construction stakes, and we'll be displaying them in the building lobby when it's completed. You do not need to sign your stakes, but please feel free to if you'd like. Before we place our stakes, I would like to invite the Reverend Darrell Ward, who is pastor of the Omega Baptist Church, to lead us in a benediction. Reverend?
Would you bow with me in prayer? I read for you from Deuteronomy chapter 11, beginning at verse 8. Therefore be careful to obey every command I am giving you today, so you may have strength to go in and occupy the land you are about to enter. If you obey, you will live and enjoy a long life in the land the Lord swore to give your ancestors and to you, their descendants, a land flowing with milk and honey. For the land you are about to enter and to put stakes in and occupy is not like the land of Egypt from which you came, where you planted your seed and dug out irrigation ditches with your foot as in a vegetable garden. It is a land of hills and valley with plenty of rain, a land that the Lord watches and cares for. He watches over it day after day throughout the year. And now, O God, may you bless this land, this ceremony, these stakes, these well wishes, the Cassano family, and all of these hardworking people, and yes, God, especially the patients. In the name of Jesus we pray. Amen.
That brings a conclusion to our ceremony. Please join us for refreshments after placing your stakes in the area to my right. And please don't forget to pick up your commemorative timepiece before you leave. I want to just take a second to pay a special thanks to Frank Engler and Carol Insko from the Kettering Medical Center Network Marketing Department. Those two and their folks helped us arrange today's event, and there are many others who have helped with this event, too many to mention individually. But please, please accept our gratitude for your efforts. You all know who you are, and you're the best. Once again, thank you for joining us today to help us recognize such a great commitment to the Dayton community. Have a great afternoon.